It's me, Andrea. I'm here another day. Yay! Here on News Talk KFC7. You've got the afternoon brew for the rest of the afternoon. I'm here till 6. But it is 3:12, and it's time to have a talk with our friends, our dear friends over at GRMC. You guys have so much going on. I wanted to introduce two very important people with the organization. And I say very important because anybody who's been a patient at a hospital knows that, one, the people that make that hospital or clinic go are the nurses. And those are the people you see during your entire stay there. I'm not trying to put down the doctors, but we know as patients. I'm just trying to prop up the nurses is all I'm doing. You guys do fantastic work. We have Jennifer Cruz, who's the nurse manager at GRMC, as well as Kathleen Ho, the chief nursing officer. Tell us a little bit about what you do over at GRMC.
Well, I guess I could start. My name is Kathleen Ho. Yes, I'm the chief nursing officer. And I oversee, of course, the nursing department, and I make sure that everything is working and operating well in all the nursing department. We do have 12 nursing departments that that we have to provide service to. So that's basically my job. And Jennifer here has actually a bigger job.
Sort of. Okay, so I'm Jennifer Cruz, and I'm the nurse manager for all the adult units. So the adult units include the intensive care, the surgical unit, and the med tele.
See, you both have two big, very important jobs. we know. We talked about this just briefly before you guys came in here. There was a problem with the nursing shortage, and I remember that making the news some time ago. Now we have GRMC. You guys have 285 nurses. So how were you able to get past the H-2B problems and get more nurses into the facility?
Well, we did some local recruitment. We do have University of Guam here that's producing nurses, so we did reach out to them. We also have off-island hires from the mainland, and also we're still utilizing travel nurses, what they call it. It's like an agency nurses that do assignments here for a short term, 12 to 13 weeks at a time, especially for our specialty units.
So it's kind of like a temp service, and
yes.
So you would rotate people through.
That's true. Yes.
And then if I might add, we also have GCC.
Yes,
they have the LPN
also,
program,
yes.
So we rely on them as well.
Okay, but you have also with the university, right? There's also that program that's been around for some time. Okay, so a lot of news for you guys. You guys are now in operation for 2 years, and you've launched your 2 Because of You campaign. We saw the float at the Liberation Day. Fantastic job with the mock-up of the hospital. I was like, wow, okay, that must have taken a lot of work. Yeah, I'm sure a lot of people worked very, very hard to get that together. And so we see that GRMC is actually doing a lot and in the past few months to reach out to the community. You also had a health fair on Sunday. Could you give us, I'm sorry I didn't get to you guys before the health fair, but tell us a little bit about what happened and maybe if we expect to see another one coming up soon.
Sure. So, like I said, the whole concept for the anniversary 2 Because of You is meaning like we become 2 because of the community, because of Guam, because of the employees that we have. So we wanted to give back to the community. That's why we had the health fair done. So during the health fair, we had our physicians that are servicing our specialty clinics. They were there and they were ready to see. Not really see a patient, but talk to the patient and see where they can help them.
Okay, that right there alone sets your health fair apart from many other health fairs, because it's rare that I've been to a health fair, and a lot of times they're in the shopping centers and whatnot. You don't see very many doctors attending. A lot of times they're specialists or people from nonprofit like the Diabetes Coalition will show up, or you have representatives from public health to come and partner and participate. But rarely do you find a staff of doctors at a health fair. So tell us what again, I think that's really important because that sets it apart from any other health fair that happens. Tell us about some of the consultation that doctors were able to provide.
So we have our endocrinologist in there. So he was able to talk to them about any diabetes, because diabetes is something very common on island. I think each one of us knows someone who's diabetic. So he was there. He's able to talk to patient about, about their condition if they were requesting for information. We also have our pulmonologist in there, Dr. Agustin, which also have talked to several of the patients there regarding any respiratory issues. We also have Dr. Powell, our neurosurgeon, in there if you do have some complaints about your back or some other issues about, neurology, meaning your brain all the way down to your spine.
I met Dr. Powell. Dr. Powell came in to talk about neuropathic pain. And we just had some listeners that questioned the validity of pain. And so he was able to clear up some of that with us. So who else did you have?
And we also had our Dr. Yamamoto, who is our infectious disease doctor. Dr. Shea was there also, Scott Shea, our interventional neuroradiologist. And we also have people from our other services. They're not physicians, but they do run. They're also considered a pillar for our services also, which is our professional support services such as radiology. We have our rehab services there, which they talk about body mechanics. They actually have demonstrated. We have our ortho tech available there, and he actually did a demonstration on how to put a cast. And also
breast exams.
Yeah, that was
the cool part.
That was actually the highlight because
Wait a minute, you didn't do breast exams at the mall.
We did.
You did?
It was so cool. We had what's his name?
Mr. Ruel Tumuning. He was one of our radiology tech in GRMC, and also Sarah was there. She's our mammogram tech. So they did went ahead and demonstrate how to properly assess, and examine the breast for any lumps. And it was actually cool. They were not expecting.
They had to stand up and they had to do their exams. It was really fun. The audience had a good time.
What are some of the things that you're hearing from a lot of the people that came to see you? What are a lot of the concerns that they have? Maybe not just personal, medical concerns, but maybe concerns about insurance. There's a lot of the business of healthcare, a lot of it making the news, and it may confuse patients as to what's going on with their healthcare. What were some of the concerns that were brought to you that you were able to address?
Actually, they were asked. There was actually not a lot, but there was just a question that was posed about one of the participants there that went and visited our hospital, and he was told that we can't see him because of his insurance company. So I told him that he needs to work it out with his insurance company because it's really like everybody else can come and get the services that they need from us. And if there's any problem with the coverage, I think they need to take it up to their insurance company if there's any coverage issues that they're experiencing. But we're basically open to accept any patient. Basically, whether you have insurance or not, you just have to go through the process. Of course, it depends on which services you're trying to get also.
Right. And I think to clarify some of that, the issue was what type of services you were receiving if they didn't have coverage, right? Like it would have to be a sort of emergency or life-threatening service. You would be able to take them, but if it wasn't, maybe you can clarify that better with the right terminology.
Sure. I believe you're talking about EMTALA, which is an emergency services, right? So emergency medical. It's actually EMTALA. I don't have the full word, but it covers emergency services and labor and delivery services. So if you coming in with emergency needs, that's not the first question. The question should not be what's your insurance.
Right.
It should be how can we help you, and that's how we're putting it out there. That if you are in need,
you treat the person regardless if they can pay or not.
Exactly.
Right.
And EMTALA covers that. But regardless, if anybody walks in our door with a medical emergency, we don't care if they can pay right there and then. We have to treat the person.
So and I'm not sure if you'd be able to answer this question for me. So obviously you have a huge region in the north that you would cover. So if anybody responding to emergency services and bringing, is it protocol for ambulance or any of that, is that immediately they go to the nearest hospital? How does that work on that end? I'm not sure if you're able to answer that.
If it's an emergency, like I said, like patient is stopped breathing and we're the closest facility, they would go to GRMC.
Okay.
And then if they have other issues like insurance or patient requests, and if it's not quite an emergency, then they have the option to go to GMH or Navy Hospital.
Okay, so you would come in, or the EMTs would assess that, and then follow the guidelines as set forth by, EMTALA?
No, with EMTALA, it has more to deal with if you show up at our doors.
Yes. Okay.
We treat you whether or not you have the ability to pay.
So essentially there's a protocol that an ambulance or an EMT would follow to determine what hospital they need to go to.
Correct.
Okay. Got it. I mean, I'm sure we've had this problem before because we do have Naval Hospital and we would always be confused. Well, when is it that a patient would be taken to Naval Hospital and not? We know people who weren't in the military that were taken to Naval Hospital, and so I think these are pretty common questions if you're not in the business of healthcare. As just a consumer or a regular patient, if I live in so and so village and an ambulance came to pick me up, where would I be going? I think those are really important questions to ask. And of course, it stands to reason that with a much more upgraded facility, that there may be a lot of people desiring to go to GRMC for the equipment and the number of beds and et cetera, et cetera. Speaking of the number of beds, you just added 10 additional beds in the surgical 2 unit on the 4th floor. That raises it to 125. And then you're very close to your goals of maximum capacity and being able to service as many with the number of rooms that you have. Tell us a little bit about how we got there and what is it going to take to get those 11 more beds in operation.
Sure. So actually that unit was designated for as a pediatric unit. But we saw the need for more adult beds, so we don't want to hold them too long in emergency room. It's not the best place for them to be held when they needed hospital care. So we decided to open up additional 10 beds. We did had enough staffing to allow that to happen. And actually Jennifer can actually talk more about the 10 beds because she oversees that and what kind of service are we offering for those adult beds. So you might want to...
Those beds actually are like med-surg type of beds. One of the things that we see in our everyday activities is that there's not enough adult beds. And what happens is when there's patients waiting in the emergency room, sometimes there's patients waiting to come out of the recovery room. So we said, you know what, let's open up some more beds to give us some wiggle room. And that's what that is. And actually it's worked quite a bit. So now emergency room has not been fighting with the recovery room to get beds. And the whole point of that, again, is to,
make our patients comfortable.
Yes, we try our best.
Right, so that tells me if you were a little bit short on beds in the surgical ward or surgical units, that you're maybe doing more surgeries than had been anticipated.
That as well, because we've had new services. Like I said, we've added Dr. Powell. He's been doing a lot of procedure. Our orthopedic is also picking up the orthopedic surgeries.
ENT also.
ENT as well.
ENT is ear, nose, and throat.
Yes. So we've added some doctors. Of course, when you add more doctors, they provide the services that they're experts on.
Right. So Kevin is fantastic about sending us information when a new doctor comes in. We get a little bio and what their specialties are and what their backgrounds are. So we're thankful for that. So again, we talked a little bit about the growth at GRMC, and as we've seen, slowly but surely. I was there actually. I hosted an event, or I helped coordinate one of the cement pouring events over there a few years. It was in 2012, and it was on 12/12/12. Oh
wow!
And so I coordinated the ceremony and then and the whole festivity of it. And so as I've seen from that point, when I really started paying attention to now, to see a fully, operational hospital.
So you saw us from ground zero.
I literally, ground one.
Oh, ground one.
Ground one. Right, because it was quite a task because the cement pouring was on an upper level.
Yes.
And so, we were like, they wanted to get this on video and live feed, and we're like, well, there's no power. Are we going to run all the cabling? It's not downstairs. Oh my gosh, they want to guess. We literally did the cement pouring. It might have been third floor or fourth floor. Okay. It was pretty high up, but it was quite an adventure for us and our team. But again, it's overwhelming to see such growth in very quickly. Tell us about some as you continue to celebrate your second year in operation. What are some of the things that you have planned that are coming up?
So we would like to, continue to offer more to the community. So we're also looking at bringing in much more services that's needed for the community. Right now, we're still kind of beefing up. Maybe I should say that, sprucing up our surgical department, cardiology department. I know we had offered open hearts in 2016 initially, and that's something that kind of was put on hold because of the staffing with the H2, the visa issue. So we're working on building that again. So we have cardiologists that are coming on board if it's around August. So you will be getting another bios, another bios from physicians. So those are the things that we're working on. We're building, of course, our surgery department, cardiothoracic surgery, and many more. And like I said, also another thing that we're looking at is, of course, ophthalmology, where we're trying to, bring a much bigger service for the ophthalmology. So we basically cover each part of our body, basically. And we actually, you asked me a question earlier regarding what are we going to do with the next 11 beds. How are we going to open that? So those beds that are now open are actually our specialty intensive maternal unit. So we're trying to just find nurses that are, really, really skilled and to take care of patients who are intensive, the intensive maternal child, meaning that, if you have your high-risk pregnancy, then that's the area where you're going to be admitted if you do experience some of the signs and symptoms of, delivery, you're getting ready to deliver your child. But, so that's the only unit right now that's actually not fully open. But we do have our labor and delivery unit. We still take care of those high-risk moms, but we want to make sure that, there's a unit designated for them. And that's what we're working on right now.
We're here with Kathleen Ho, the Chief Nursing Officer, and Jennifer Cruz, the Nurse Manager at GRMC. We're going to continue this conversation. Give us a call, 477-5757, if you have any questions. 3:42 in the afternoon here on News Talk K57. We're taking the time to enjoy me some Elton John. That's definitely my Monday mood today. I don't know about you ladies. Might be too young for Elton John.
I'm right under you.
I was telling you, it was a compliment that you look so young and beautiful still.
All of us.
People don't know who don't know. We are fellow alumni from the same school.
Yes.
But I know your sister, who I adore very, very much, and I do miss her. Can't wait till she comes home again. Again, so thank you again. We have Kathleen Ho and Jennifer Cruz here talking about some of the things that are happening at GRMC as we celebrate your second year in operation. One of the things I wanted to note again, you have 285 nurses now on your staff. That's 40% of your entire staffing at the hospital. Again, I think as patients we understand why. The types of services and just the day-to-day care that a patient needs, really that's not under the purview of the doctor. That really, it takes a lot of nurses to make that care happen. Tell us about some of the things that people don't realize that maybe your nursing staff is responsible when it comes to their health care.
Okay, well, like you said, they're there from the time, I guess, you open your eyes,
right,
all the way through your discharge. So when you're ready to leave the hospital. So basically, a day-to-day life of a nurse would be, of course, to see their patient in the morning. I mean, this is when you start your shift. We do have couple shifts that we have in the hospital. It's a 12-hour shift for each nurses. Each shift for the nurses. So when they start their shift, they normally would go see their patient, ask you how you're doing, of course, and make sure that you have no concerns, complaints of pain and so forth and other issues going on. And if they do, then they will address that. They will be with you throughout their shift. If you call for, there's going to be assigned time for them to deliver medication that's been ordered by physician. They would be the one to tell you if there's any procedure that needs to be done, some kind of like maybe x-ray maybe for the day, and they will tell you those, whether you need to see your physical therapies as ordered by your physician. And then they go, and anything you need, when you need, just press that call button and they'll come and ask you,
right. So
you need.
On top of you having to execute a certain level of care for the patients, you're also in consultation with the doctors.
Exactly.
So whenever the patient complains about something, you're in contact with the doctors. I think that's one part of the whole, complexity of your job. Because of course you can't administer or do anything
without an order.
Without an order, and so the consultation with the doctor is extremely important. You're the interface. You're the sort of infantry between the patient and their doctor. Yeah. Tell us a little bit about how that process is. That let's say I'm a patient and I say, let's say I'm going into labor and I'm like, oh man, I'm in so much pain. What can I do?
We're not L&D nurse. So
okay. See, that's it. Well, you know what? That's the one thing I can relate to.
Basic nursing. You assess the patient. You do your whole nursing process. You assess your patient, and then when you determine what the need is, then you call the doctor and you say, listen, doc, I have this, 27-year-old female. Gravid 2, second baby. This is the second baby. She's 2 centimeters dilated. Blah 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 blah. What do you need me to do?
Right.
But in our case, because we're adult nurses, we're med-surg type of nurses. Our situation would be more like, doc, our patient hasn't had a bowel movement in 2 days, or our patient's in pain.
That's when anybody who's been in the hospital, man, having to monitor the poop is probably not one of the fun things that you guys do.
And people don't understand that.
Why we always ask
as adult nurses, one of the things, especially after they have surgery, patients look at us like, why do you care if I poop today? Or why do you care if I'm passing gas?
Yeah, well, maybe you can explain that to us now.
Well, bowel function is very important after abdominal surgery, especially because the way they maneuver the bowels and, when they do surgery. Yeah, so that's one of the things we want to make sure is that there's no obstruction.
The pipes are working. That's what they always say. The pipes are all working.
Because all my nurses would come in and say, "Did you have PM?"
Yes.
And I'm
or did you pee?
That's right. That's the first. Note the first time they pee, and then they. Okay. So again, that concept. I remember when I went in, because that was for one in particular time was for labor and delivery. The nurse comes in and says, "Doc says to check the position of the baby. You might be a few days early." So that's why I asked that question, because I think that is a vital critical
Andrea,
role.
That's a skill. I can speak for L&D because I actually started out
First of all, being able to read doctors' writing is I don't know if they have classes for that in nursing school. No, that's
pretty good actually. We and it's to the point where we can actually see a signature and we're like, that starts you doing it. That starts Olivia Cruz.
Okay,
that's what this says.
Kudos for that already, because that's probably one of the hardest things that you guys have to do is decipher code.
But actually now everything's computerized, so it's easier.
It's easier
we're the older
to read.
nurses.
But we've gone through that, where you have to read a doctor's handwriting, and you're right, it takes the skills.
We're pretty good actually.
it takes skills to really read the handwriting. So,
but again, it's such an important job. My brother-in-law who's visiting he does ultrasound. And so for him, I see the importance because he's the first line of defense between him and the doctor that is actually reading the testing, because he sees anything, whatever he sees, because he's trained to read the machine, anything abnormal that he may see, the doctor relies on that information, and that's the first line of defense. And so, again, why communications in the hospital is important. And I think, to me, obviously for the patient, comfort and care, you know, from our perspective. But I think, again, one of the most important things that you do is you are that first line of defense, and you are the consult with the doctor when most of the time the doctor is actually not physically there with the patient. And you are the group that actually gives the patient some peace and comfort and hope during their stay in the hospital. And I know that's important to all of you.
Yes, of course.
Yeah, we play a lot of roles. Yeah, we're advisor, we're advocate, we're everything. We're basically we're the buffer person sometimes if there's a miscommunication also.
We're going to take a real quick break for our traffic report, but when we come back, we're going to close out with whatever festivities you have going on to celebrate and commemorate your second year in operation. 3:54 in the afternoon. I don't think there is a person that can exist that can say that they're tired of that song. I don't think it ever gets old. Jennifer's smiling, so I'm hoping she's enjoying. I am. Our music.
I was just telling Kathleen I like the song.
Right. Yeah. I don't think that song ever gets tired or old. Thank you so much for joining us. If you're just tuning in, we have some lovely ladies. I know probably behind closed doors all the doctors are saying these are the ladies that make our worlds go round. Kathleen Ho, Chief Nursing Officer, and Jennifer Cruz, the Nurse Manager over at GRMC. I wanted to talk about, we just got a few minutes left. You have been in the news a lot lately. Again, I think GRMC is doing an excellent job lately as far as outreach goes. And so we're seeing many efforts in the community, I think, to make any hospital, whether it be a public or a private hospital, it takes a community effort. I mean, even in some of the press releases, you thank your partners, which is Public Health, Naval Hospital, and Guam Memorial Hospital. I think our community is best served when our medical professionals all work together. So tell us about what you have. Obviously, you had a health fair yesterday, and that was probably one of the bigger events that you were planning for your anniversary. Tell us about any sponsorships, outreach that you may have coming up that you're aware of. I know you guys are your field is very specific, but any that you're aware of, and then what you're preparing your goals, I guess, for the next year to make it to 3 years.
All right. So we do have like the rest of the beds that needs to be open, and that's one of our priorities to do. It's basically to give us the 100%.
And all of those 11 beds are for high-risk pregnancy.
It's actually a mix of some of the pediatric department as well. We have to shut down our intensive care unit, which is only actually 2 beds of intensive care. So we can't provide intensive care for pediatrics as of the moment, but we're working on getting that. Hopefully by the end of this year or before the year ends, we should be able to reopen that. We do have the intensive maternal units that we have. We do have some delivery rooms that still needs to open. So it's actually like just parts of the different units in the hospital that we need to completely open.
Okay.
So, and of course, majority of the factors that you consider is the staffing. We need to have those experts for that area to be able to open that. And then, like I said, community outreach. We always participate with the community outreach, or we do sometimes lead it. I know what we have so far going on is our patient education. We do offer classes actually.
You just started a smoking cessation.
Yes, so we offer that anyone who's interested in quitting smoking, we can help you. All you need to do is call us. We will give you the scheduled classes that we have offer. We actually just wrap up our chronic diseases lectures. So for those who wants to make some changes in their lifestyle, if they do experience or they do have chronic diseases, then we're there also to be able to provide you. And the classes are free. We don't charge them. We actually even offer them food if they come.
Oh, nice.
Because it's done.
So if you're hungry, head over to GRMC and the next we'll check the work.
Healthy food, right?
Healthy food.
I'm down for the veggie tray.
We give them a brown bag type of, like sandwiches and.
Speaking of which, I just have to say that your little shop has some pretty awesome snacks.
Their cookies are good.
Yeah, the cookies I think is what
the cafe?
Yes. I'm just
like
putting it out there.
Yeah, their cookies are good.
Yeah, the cookies are good.
Shout out to GFS, actually.
I was going to say shout out to whoever's running that place because
GFS.
I was really hungry one day when I was over there. I'm like, I'm just going to grab a cookie because and I was like, wow, this is a really good cookie. I wish I got another one, but thank you so much. Okay, so you want to open the 11 beds. You're always participating in community outreach. You have your free classes. With their veggie tray.
With not really veggie tray.
I'm just kidding.
We've got to keep in, the healthy.
Right.
Yeah, but those are open for public, and we do put out the announcement. Sometimes we put it in the newspaper as well. But
and
you
it's
can
on your website.
Yes, you can visit our website. That's www.grmc.gu, and you could go ahead and look at what are the classes being offered, or what are. That's where they're gonna get the latest actually on what's going on with the organization. So that's one, and of course, like I said, we're trying to spruce up the other services that we think the island needs, such as the cardiology services. So that's coming very, very soon.
A lot of this again could not happen without the availability of nurses. Thank you for giving back to our community. And again, I think as a community we recognize the value of nurses. I wish I was brave enough to become one. I'm going to give you guys